I'm Dr. Lennon. I am one of the urologists here at Yale, and I'm the Director of Medical Education. I also was a resident here in urology at Yale and went through that not too long ago. So I would love to talk to you guys about what someone who's interested in urology might want to do. So there's a few different things to think about. The main thing for urology is that you're going to do away rotations. So you'll do your home sub-I, and then most people will do 1 or 2 additional rotations. So that's gonna be a lot of your urology exposure and where you're learning about the content of urology. For electives that you might wanna choose within the Yale curriculum or in your medical school would be things that can either add to your surgical skills or, on the other hand, complement the knowledge that you're going to want to accumulate to be a great urologist. I really think that it's so important to take the opportunities that you have in medical school that you may not have later in your career to get important exposure to different things that is really relevant to know as a urologist. So things like anesthesia, that's a great option for someone who wants to do any surgical specialty. And that would be just to see what their pre, intra, and post-op experiences are that are going on parallel to what you're doing in the operating room. Another example for urology would be interventional radiology. We more and more focus on endoscopic procedures, and getting the exposure to see what they do is very relevant to our field. Another example of something important or that might help complement would be either gynecology or nephrology. Those are 2 specialties that aren't necessarily going to help your surgical skills directly, although gynecology does some surgery, but doing the clinical aspects of those, seeing female pelvic health from a clinical perspective from a gynecologist, as well as seeing a nephrologist and all the overlap that we have in urology there. On the other hand, getting exposure to add to your clinical skills is also really important. So options include urogynecology or gyn-onc. Those 2 have a lot of pelvic surgeries, or general surgery that has abdominal and pelvic surgeries. GI surgeries are all very relevant to what we do and will be really complementary as well.